The amount of blood that the heart pumps per minute is equal to the rate of venous return and therefore is equal to the rate of blood flow through the entire circulation. Well, the cardiac output, which again is between 5 to 6 liters per minute, is distributed unequally to different organs because of differences in resistance and flow to those organs. So for example, if we look at this table, what we find is that the GI tract here has the largest percent of blood flow, followed by skeletal muscle, which has a larger increase in blood flow. And then such organs as the kidney, then we see the brain, and then we have the rest of the organs, and all of which together will constitute 100% of the blood flow. However, this is going to be based on the needs of the body, and so these areas with high percentages obviously need higher amounts of blood flowing to them. With the principle of diffusion, so blood will flow from regions of high to low pressures, okay? So that does not change. And so blood flow will go from high areas of pressure, again, to low pressure. And so the rate will be directly proportional to the differences in pressure. So we have this simple equation where blood flow is equal to the change in pressure divided by the resistance. So the change in pressure is going to be the driving force that will push the flow of liquid through a pipe. And so our pipes being our vessels. And then the resistance will be how much hindrance of flow to the liquid there will be for those pipes. And so when we look at changes in pressure, we're looking at differences between the two ends of the tube, okay? And so the rate of blood flow, again, is inversely proportional to the frictional resistance to blood flow within the vessels. And the resistance will be the sum of all the factors that inhibit blood flow. And so this too will affect cardiac output as well. If you remember, cardiac output with the equation of mean arterial pressure is divided by total peripheral resistance. So thus a higher resistance will decrease the amount of flow, whereas a lower resistance will increase the amount of blood flow. The resistance of blood flowing to the organs will be affected by 3 different items. And so ultimately, this resistance will affect the velocity of blood flow. Okay, so the first thing that we look at is the length of the vessel. So a longer vessel will increase in resistance. So the farther away they are, then that means that there's an increase in resistance to them. However, this factor does not change except for when a person grows. So typically the length of our vessels will not change as we progress with age. Viscosity is going to be another variable that will affect the resistance, and this is the thickness of blood. So if we have an increased thickness or an increase in viscosity, then we have an increase in resistance. And so one example though of when this would occur for an increase in viscosity would be with severe dehydration and with polycythemia, which is high red blood cell count, both of which will depend on concentration of cells and proteins within the blood. And so for example, with polycythemia, we'll see this in areas with high altitude. However, viscosity typically under normal physiological conditions too does not change, just like the length of the vessel. So the determining factor then for resistance will be the radius of the blood vessel. So if we have a decreased radius, we'll have an increase in resistance. Okay, so smaller vessels will have more resistance than larger vessels. So here in our image then, here within the arterioles and within the venules, what we'll have is the smallest radius, so they'll have the largest resistance for blood flow to them. So no surprise here, where some factors that affect blood flow include the autonomic nervous system. And so these are not going to be equal to all organs, but rather it's going to be based on organ needs of blood flow. So let's begin with sympathetic nerves, and this is where we'll have an increase in cardiac output and an increase in total peripheral resistance. And this is mainly due to the release of norepinephrine, which they will bind again to alpha adrenergic receptors. And so the norepinephrine will bind to smooth muscles on the arterioles in the viscera in the skin to stimulate vasoconstriction. And so even when a person is calm, this sets the tone of the vascular smooth muscle, all right? And so vasoconstriction then of the arterioles will also increase mean arterial pressure. Now, during fight or flight type of situations, we'll have blood that's diverted then rather to the skeletal muscle and be constricted in the digestive tract, kidneys, and skin. And so the vasodilation that occurs with the skeletal muscle is going to be due to cholinergic fibers, and so they will bind with acetylcholine and also with epinephrine, which is going to bind to the beta adrenergic receptors. Okay, so we'll have vasodilation with sympathetic innervation for blood flow, but we'll have vasoconstriction with sympathetic fibers for organs such as digestive tract, kidneys, and the skin. So then parasympathetic nerves, this will have the opposite effect where, as a reminder, these are going to be cholinergic, so they'll be with acetylcholine that will bind on either muscarinic acetylcholine receptors typically, okay? And so here what happens is when acetylcholine binds to those muscarinic acetylcholine receptors, then we'll have vasodilation. And so this is limited only to the digestive tract, external genitalia, and salivary glands, and is less important in controlling total peripheral resistance due to limited influence. And again, so with parasympathetic division, this is going to be our rest and digest, so not as critical when we're, as it would be like with in a sympathetic stimulation, so like a fight or flight type of stimulus.